Welcome, Erica, to my podcast.
Hi.
It's Leaning into Therapy, and this is a podcast where I interview therapists about different type of like therapeutic techniques or things, tools that we use, what you're into. And so today I have Erica Thibodeaux.
Hello.
Hi, Erica. Can you tell us a little bit about yourself?
Yes, exactly. I was going to say, you want me to just say it? So I'm a licensed professional counselor, but in Minnesota, we have to be a licensed professional clinical counselor. So I'm in Minnesota. So I had to get this extra letter because that's what we call ourselves here. And I am in private practice and I work with teens, adults, sometimes kids and families. And I do a lot of work with mindfulness. Mindfulness and attachment are a big foundation of my work. And so that's why Keisha has me on here today. We're going to talk about some mindfulness.
We will have to cover attachment another time because I geek out on that as well. Okay. So, and today, because I'm doing a class for professionals for LPCs and LCSWs, and I'm offering it January 27th, and it's on OCD. So treatment for OCD and like identifying, being able to diagnose it. But I feel like when you're using the tools of ERP, exposure response prevention, which is the treatment for OCD, you have to kind of tweak your counseling skills. And I mean, which are good, they're good to tweak anyway, because the way that you have to like gear it towards helping people, I think it's good for anxiety disorders and everything. So I wanted you on to discuss like the edginess of mindfulness, because, mindfulness gets a rap. Like it's this sweet, we're going to be like so mindful. And it's going to feel great and awesome when we're mindful. And anyone with an anxiety disorder, phobia, panic disorder, anything, OCD, it is not a sweet, comfortable place to be, right?
Absolutely. And okay, before we even jump into this, I just want to shout out to anyone who's considering taking your training, that I took your training the first time you offered it, and it was incredibly helpful. I was referring people 2 hours away for ERP, and it just is a incredible tool. I think every counselor should be trained in ERP because we need to know what to do with that intense anxiety or OCD. When it's coming in the door, we need to know how to spot it. We need to know what to do with it. And exactly what you said and what you taught me was that, the way we want to connect relationally with our clients does not work. All of that encouraging and all of those micro skills don't necessarily work when we're dealing with anxiety and OCD, because we can be reinforcing the problem. And that is so hard to spot. And I just have to say, take Keisha's training. She is an expert. She's been doing this for almost 2 decades. She's amazing. And it was so applicable. I loved the way we did it in 2 parts. I don't know if you're doing it the same way, but it was like, I loved how it was just so applicable. I could leave and start applying this technique immediately. And she like tools to take with you.
I know. And I think ERP is different for a lot of counselors because it's a behavioral approach. And yes. I didn't even look at it that way because I love behavioral approaches, but people that took it were like, this is a behavioral approach. So it's such a different way of doing therapy. It's like these tasks, step 1, step 2, step 3. Yeah. So, but it does change. I think that exposure response prevention whole protocol changes the way that you treat any anxiety disorder. Like, are we doing anything to enable or reinforce their anxiety and their compulsive pattern? I mean, that is what has been like mind-blowing for me.
Yes. Yes. Same. And even just in general, the concepts, when I'm working with parents who have a really anxious, avoidant adolescent, and how, the nature of the parent is to go with the anxiety and not encourage the adolescent to move through it and to be exposed, and it's just so It's an approach that really needs a step-by-step process and training and consulting, consultation. So
I-
I recommend the training.
Erica, thank you. So how would you, because I think when I offered the course, I don't know if I completely understood how to use mindfulness appropriately for treating OCD. How do you think mindfulness should be used with OCD?
I think both. Okay, so any there are so many things that work against us in mindfulness. So mindfulness is to pay attention to what's happening in this moment. And I think that our our mammal tendency to protect ourselves makes mindfulness really hard when there's something happening in our nervous system like anxiety or OCD or trauma. It kind of goes along with this, that teaches us to override this difficulty, this painful experience, so that we can go on and survive, right? So when we have anxiety and we avoid, we're often avoiding the thing in the moment, the painful experience, or we're trying to prevent something from happening. And so mindfulness counteracts all that. Mindfulness asks us to pause and to feel this thing,
Discomfort.
like this really this difficult feeling. And if we have zero tolerance to experience discomfort, and to be in that, basically to experience dysregulation and like tolerate it and titrate. I'm always like titrating people into tolerating their discomfort or that dysregulated feeling, so that they don't have to jump into the avoidant behavior, like with OCD, that seeking, the prevention seeking.
Well, right. And doing the compulsion. Yeah.
Exactly.
Okay.
So, what mindfulness does and why it's so hard is it asks us to be in the moment, and the moment might be really intolerably uncomfortable.
Mhm.
And like, think about just our modern world. There are so many ways to not be in the moment, or just to make the moment feel better, right?
Mhm.
We can just distract, we can disconnect, we can connect to other things that aren't our bodies. And we can there's just so many things at our, fingertips right there for us to not feel the moment. And then our ability to do it kind of dwindles.
Well, and it's interesting, I think, because like compulsive behavior, hand washing, there's thought compulsions, right? Memory checking, scenario bending. There's stuff we do externally, counting, walking through doors, tapping. I mean, there's all these different compulsive behaviors you can do, both internally and externally, that make you feel a little better, right? And
Yes.
distract you just for a moment from the distress. And so that is, I mean, I guess, if we look at it in anxiety disorders, it would be like, I might be on my phone a lot, or
Mhm.
I might be watching TV, or I
Mhm.
might be hanging out with people all the time just to not feel that discomfort. And
Yes.
so by being mindful, we would actually, like, in that moment when it comes up, sit with the distress, huh?
Yeah. Sit with a feeling. I mean, it really is what you're asking clients to do when you're doing ERP. You're asking them to tolerate 10 seconds of the feeling, or 1 minute, or working your way up to 10 minutes, and I mean, I think that's how you do it. That's kind of how, like, some of what I took from it. And it really is, at its essence, mindfulness. It's being present in this moment with what is happening.
And the terror or uncertainty of it, right? Because with
Right.
OCD, it's very uncertain. So
All of that.
I think I want to do like an example, Erica. So, okay. So in the past, I would have like an illness or something, and I would kind of obsess about the sensations in my body. And then compulsively go to doctors to figure out what it was, thinking I had cancer, I was dying, whatever else. It was very uncertain, right?
Mhm.
Um, so if we were to do mindfulness with that, what would it look like?
Well, so one thing I just want to say is, if you're going to begin practicing mindfulness, practicing it, learning it, and starting off for a very short amount of time when you're not in distress is easier than trying to begin when you are in distress, when you're really distressed. But just sitting with a timer, and I would say if it's really hard, sit for 10 seconds, 30 seconds, but just set a timer and sit and notice. So you would notice, I feel a sensation in my side. Oh, wow, that is really alarming me. I feel whatever, right? Like you're just noticing the feeling in your body. You're noticing the thought that comes with it. And you're just letting it happen, because actually feelings don't take that long to work their way through your body. I heard one bit of data was that it takes like 30 seconds or less, but I don't know exactly if that was like emotions or what exactly it was referring to. But in a training I was in, it was like a neuroscientist said, the actual experience of the emotion takes 30 seconds to experience. I know. And so, and I do think that our fear of it is often so much bigger than the actual experience of it. But you would notice the sensation in your body. So let's just do it right now, whatever it is you are experiencing. So I would just say, if you're comfortable, you can close your eyes, or you can just bring your attention into your physical body and just notice like any sensation that you're feeling in your body. And tell me what you first notice.
First, I noticed it like a little tension. There's always tension in my stomach, no matter what I do. So just a little tension in my stomach. And then I noticed like a sensation on the bottom of my foot because of the way my feet are.
Okay.
That's actually more, the feeling on my foot is more intense.
Okay. So just stay with the more intense one and just feel it for, I'm just going to go for 5 seconds. Just feel it for 5 seconds. Okay. What do you notice now in your foot, in the bottom of your foot?
So my squirrel brain, that's it's kind of got distracted from that. And now I'm back to the stomach.
Yeah. Even in 5 seconds, it can be really hard to stay focused on one thing. And there's no rule that you have to stay focused on that one thing. So your attention went to your stomach. And so I think that when we're beginning mindfulness, we notice what we notice. So sometimes when people sit still for the first time and try to notice what they're experiencing, it's just excruciating, because all the parts of you that have been being ignored so that you can go to work and help people and be functional and like do all the things that life requires of you, all those other parts are like, oh my gosh, you're not busy right now. Great. And it makes you think of this and this, and like it can just be so overwhelming. It can be a flooding experience. So you mentioned, when we're thinking about anxiety, that can be that we can be flooded with information, we can be flooded with fear, we can be flooded with thoughts, body sensations, all the things that we just luckily as humans can compartmentalize so that we can go on and like do all the things we have to do. So mindfulness brings us into awareness of all of that.
Well, and when I guess we did focusing a long time ago. I've been doing stuff like this for so long. But yes. I remember when I started doing it and becoming more aware of my body, it was like my little brain was like, and what about this? And what about this? And you need to get up, Keisha, and you need to do this. And don't forget to do this. And don't forget. I mean, it was like non-stop. And now, because I've done so many of these types of process, I just can sense feelings or tension or sensations, right? But I think for most people, it would probably be the monkey mind, as they call it, right?
The mental chatter. Yes.
Yeah. That you have to kind of clear through.
What you were mentioning, focusing, just in case people are curious about that, it's the predecessor to somatic experiencing, Eugene Gendlin, and it's noticing the felt sense. It's noticing the body. And so I think, honestly, when I learned about focusing, my mindfulness teaching just went to a whole another level, because I think that where mindfulness comes from is from Eastern practices of meditation. And I think that what our culture really left out was that it's not quieting the mind, it's listening to what is now, like what is now. And so much of what is now is our body, it's our thoughts, but it's like this whole other like 90% of us that's our neck down. And so, starting to notice that is a huge part of mindfulness and meditation. And I just think it got lost in translation. I learned focusing from a meditation teacher who was also a counselor and had been doing it for 40 years. And so in that class, it was all mindfulness based when we learned focusing. But focusing is just this practice of listening to the body. So to me, it's like they're interchangeable. When I teach mindfulness now, I just always include those skills, because how can we be mindful if we're not noticing all of us?
Well, and it's interesting that you broke it apart, because I think that when I often talk about being aware of like the sensations in your body, it is technically focusing.
Yeah, right. I mean,
but
yes, I think we're talking about things that like white men gave names to in the last like 50 years, but they're all such old practices, and they are very human practices. Because Eugene Ginlin, the guy who named focusing, he said, I wasn't discovering something, I was observing something that people do, and he gave it a name.
Oh, I love that.
Yes, because like he didn't invent it. Our bodies already do this when they're able to,
Do you think this is making me think of Lamaze, or like when people have babies? I haven't had a baby, but do you think intense experiences like that create like naturally people go to this body awareness to make it through it?
Yes, if they can. I think that if we're so even, I was actually talking to some women's health professionals. They have adopted a trauma-informed response protocol for birth, like for delivery, labor and delivery, because if they know that the person like in labor has had any type of physical trauma, sexual trauma, they know that it's going to be harder to feel their body than to sense when they need to push. Depending if it's sexual trauma or not, they may not be able to have a vaginal delivery. And so because their body is so conditioned to protect and to block out those sensations in order to survive, as we know with trauma. And so their trauma-informed approach, I think it's actually becoming more protocol more commonly in the last like decade, since trauma, we're all being trained in trauma more frequently, but they have protocols to support the mom to feel the body, because there are just so many mechanisms that mammals have to turn off our ability to feel and sense ourselves so that we can survive.
Yeah, it's so interesting. Because then, and I was comparing it to childbirth, because I think when someone is in an OCD loop, it is very, very intense for them. There is a lot of suffering going on. I don't say that lightly, and that's why I compared it to childbirth, because I would imagine that to be just as intense.
Yeah.
And it's almost like when they're mindful of the OCD, it's like putting your foot in this, like, or you're touching this intense suffering or this intense anxiety, distress. And it can be unbearable. Like you just want to jump out.
Okay, Keisha, talk about this, because one of the things with mindfulness and any type of focusing or feeling ourselves, it's easier often to do with a regulating partner, right? So when you are, I want to tease out what you're already doing this mindfulness when you are helping them to begin to tolerate the suffering.
So I think,
what are you doing in the office? Because I think you're actually helping them to begin the process of mindfulness,
I think so too. what I understand it, because I'm by no means an expert, right? I just use it in this sort of way for trauma and for OCD. So if they're afraid, like say they're afraid that they might have killed someone in their past when they were driving, right? And they have this fear and they going back in their memory. In my office, they're like going back in their compulsive loop, right? So they're telling me, yeah, I know in the past, or I think I might have killed someone when I was driving late at night. And I went back over several times, didn't find a body, but every time I went over, it just felt like I killed someone. So I feel, and they'll be doing it. And so I'm like, okay, that seems like a compulsive kind of thing you're doing right now. Like you're telling me about it for reassurance. What if we just sit with the uncertainty of maybe you did kill someone? Their face is like, and I'm like, let's just sit with it. And they'll keep talking. I'm like, let's just sit with it. So I'll just sit with them. I'm like, let's just see how many seconds, and I'll turn over a time. I turn on a timer. I'm like, how many seconds can we sit with this sensation? And I do get them to sit with the feeling in their body. So if they can't just sit with it without memory checking, I'm like, focus on that tension. Where do you feel it? Stress. And so then we just we might trace it, like the sensation, there's one where you surf the urge to do a compulsion, but some sort of mindfulness with the distress.
Yeah, that's it. And I think that, when you first brought up the topic of like the edginess of mindfulness, and especially when it comes to anxiety and OCD, I think it's not just, I think what we know is that people with a prevalence towards anxiety and OCD have different neurology. Their nervous system is doing something different that not everyone else's is doing. And it's like the bell curve. And lots of people are in the middle. Some people are over on the end where they can self-regulate and they don't have any, they have very little. And some people are over on this end where they have an intense disordered experience. And so it's like their ability to tolerate those feelings is decreased for some reason. It could be trauma. It could be, a lot of times I think I mentioned to you, like with OCD, there is a past experience where they did have an abnormal experience, like chronic illness or something. And so even though they've recovered from it, there is like obsession and compulsion related to illness, but so sometimes it's like whatever it is that causes them to be on that end of the bell curve, it makes it more difficult to tolerate those experiences. So they come up with compulsions, right? I mean, there's so much more to it than that.
Well, yeah. But I think so, there's some people who it's almost like a trauma-based reaction. I think I would be one of those. There are other people where it's definite biology. They just have more of a pattern in their brain, right? And it attaches to whatever's most important to them. So if it's a health experience, and that's what's most important. If it's their children, if it's that they could harm someone unknowingly because they would never forgive themselves if they did, that's what it attaches to. So I think, yeah, it can be trauma-based or just whatever's most important in their value system.
And then underneath that, it is more difficult for them to tolerate those uncomfortable feelings. Their ability to self-regulate in those moments is decreased for some reason, right? Whatever, we don't always know why. And so then that edginess is like asking them to practice the uncomfortable feeling is just really difficult.
Well, and I think, I've been consulting again for OCD because I'll do it every once in a while just to learn more. But I think someone's willingness, really addressing their motivation as to why they want to do this and having a formal agreement ahead of time is so important, because it is a big ask. I'm going to say, go home and you're going to purposely trigger your fear. Like if it was a phobia, if it was an OCD and it was a bridge, I'm going to say, you're going to go look at that bridge every day.
Right.
Are you kidding me? I'm going to want you to drive over a bump that triggers your OCD loop and then sit with the fear and not drive back over it again. I mean, I think those are big asks. We're asking people to face their greatest fear and to handle their anxiety in a totally different way. Because I do think the way that we handle things that disturb us is what creates that low window of tolerance, right? Then it's like,
Yes.
we're like trying to jump out of it so quick, like that frog in hot water, it'll immediately jump out. I always talk about that metaphor. We won't go into that though. That doesn't fit here. But I think I know I could snowball. I could go into other little things. But I do think being able to like react differently when we're disturbed is the ultimate goal for OCD treatment and for anxiety disorders. Like that's what we're trying to create.
Mhm.
Mindfulness is just such a good way. And I like the way you talk about it because, I'm not very hoo-hooey, you know me.
Yes.
I'm not going to go do yoga or go to any of those retreats. It's just not me. But I love how practical you make it.
Hmm. Yeah. Even when I had been a meditator for a while, but the reason I wanted to learn it was because I wanted to go and introduce meditation and mindfulness in prisons. And I did get to volunteer in our like local jail here. There wasn't like they have to want to come to it. And there were times where there just weren't a lot of females and I wasn't allowed in the male side, but I did get to do it a little bit. And the whole reason was just, I felt like being able to tolerate those feelings can help us through the most demanding and difficult experiences. And when everything is out of our control, like when we're institutionalized or incarcerated or in that nature. I was in the Peace Corps and I was not institutionalized, but I was living without running water, without electricity, without a lot of food options. And it was just really distressing. And I used meditation to get through it. Also, as we've mentioned on this podcast at our previous interview, I got sober when I was 15, was in a treatment center, had been through that process, had lived in a setting where I didn't have a lot of choice. And so I just found this tool to be so helpful when things are happening outside of our control and they're difficult. There is a place within us that we can go to be with the experience and to navigate it. And so I just felt like it's the most practical thing anyone could use. And it's accessible to anybody, because it has to just do with ourselves. Like all we need is ourselves and our attention. And I love that.
I love that. I think because we're teaching resilience. I mean, that's what you're talking about. Like, how do I instill a skill or teach someone a skill that's going to make them resilient in all areas of their life?
Mm-hmm.
I love
Yeah.
that.
Yes, me too.
Erica, this was so good. Thank you so much for talking about this.
Thank you, Keisha, for having me on. I love your podcast and everything you're doing.
I love you, honey.
Love you.